Good afternoon and welcome. I am pleased to see that we have over 700 people joining live online to listen to this town hall. I want to begin by giving a broad perspective where we are headed, and why we are proceeding in this manner. In a few short weeks, on August 23rd, nearly 30,000 new and continuing students will begin the fall 2021 semester at NAU. This includes more than 20,000 students on our Flagstaff Mountain campus. For each and every one of these students, NAU welcomes them to live, learn, and realize the limitless future that a higher education can provide. We are a student-centered university, and we pride ourselves on providing students with a personalized learning environment that meets them where they are. We will strive in all of our efforts to live up to our mission. A central component of the NAU experience is the in-person residential campus experience provided on the Flagstaff Mountain campus, as well as the in-person instructional sites in Yuma, Phoenix, and throughout the state. To that end, we are planning for a fall 2021 with the promise of a vibrant in-person experience for our students. We need to be ready to welcome our students and respond to their needs. We owe it to our students, to ourselves, to the people of our community and our state to be here in full force and not leave anything to chance. As we plan, the health and safety of our community is a critical component that runs in tandem with the imperative to deliver on our educational mission. We are not yet at a pre-pandemic normal. In fact, we will likely never be. But the landscape and environment in which we operate in a post-vaccine world has changed dramatically since the COVID-19 pandemic struck in early 2020. We better understand the virus, how it spreads, and mitigation measures. We have widely available and highly effective vaccines, and increasing numbers of our population are vaccinated. And we have direction from our governor and state legislature that outlines the parameters in which we must operate as an institution of public education in Arizona. We are deeply committed to the health and wellness of our entire community, students, faculty, and staff. And we are committed to our educational mission and the service of our students. With this context in mind, we have spent the last few weeks grappling with how best to ensure a successful fall 2021. For me and for many others, this question keeps us up at night. How do we educate and serve in a complex and dynamic environment like this? How do we move forward into a bold future? How do we deliver on the NAU promise and provide our students with an exceptional education and our faculty and staff with a supportive and invigorating environment? As I have shared with our NAU community previously, several key steps have been taken to guide the evaluative process of structuring the launch of Fall 2021 at NAU. The President's Fall 2021 Planning Steering Committee has convened to consider the critical issues, gather information, assess options, consult with experts, and make recommendations. An advisory subcommittee, the Fall 2021 Public Health Advisory Committee, has drawn on expert knowledge in epidemiology, infectious disease, public health, and more to assess critical health considerations, advise on the science of COVID-19, and what we can do to mitigate its effects, and provide a sounding board for decisions that are underlined by public health considerations. I am pleased to welcome members of both groups here today, who will provide an overview and update on our public health and scientific landscape and our NAU policies, guidelines, and upcoming plans. Please join me in welcoming the following individuals: Josh Mackey, Interim Executive Vice President and Chief of Staff, and Vice President and Chief Human Resources Officer. Josh serves as the co-chair of the steering committee and a convener of the Public Health Advisory Committee. Karen Pugliese, Interim Provost and Vice President for Academic Affairs, She serves as the co-chair of the steering committee. Paul Kime, Regents Professor, Cowden Professor, and Executive Director of the Pathogen and Microbiome Institute at NAU. Paul serves on the Public Health Advisory Committee. And Dave Engerthaler, Director of the TGen North. Dave serves on the Public Health Advisory Committee. I also want to thank the members of our NAU community for their many thoughtful questions and comments via our online feedback form. Many common themes emerged from these comments, and we will address those throughout the presentations today. Now to Paul and Dave, who will provide an update on health considerations and current COVID-19 science on behalf of our Public Health Advisory Committee. Paul, Dave.
Thanks, President Cruz Rivera. So this may seem like overload after 18 months of hearing about COVID and coronaviruses, but Dave and I are going to try to provide a little bit of an overview of the virus and the pandemic, and then also the most recent information we have about the state of the pandemic in Arizona. You know, this coronavirus isn't the first coronavirus we've ever seen. It's actually similar to other coronaviruses. Because of that, we know a lot about it and how it acts, but there's a lot we don't know. What we do know is it's a respiratory virus that spreads via droplets or aerosols that spread through the air. This is the way most people will acquire it, and that's the greatest risk for people in getting it. Now, we're all exposed to coronaviruses every year. The COVID serology study at NAU has detected almost everyone that we've looked at has these prior antibodies already existing to the other coronaviruses. You might experience these other coronaviruses as the common cold, and because of that, you have some level of immunity against it. So that's really the big difference between the novel coronavirus and these previous coronaviruses is this virus emerged, and when it swept across the globe, it encountered nothing but a naive population with no immunity and little resistance against it. And because of that, of course, now we have millions and millions of cases and a global pandemic. Now, the way that the disease is manifested is a spectrum. Every person gets the disease a little differently. And in some cases, there are no symptoms at all. In other cases, unfortunately, there's death, and we see everything in between. So that spectrum is actually complicated, the control of the virus, because asymptomatic infection is difficult to detect and difficult to track. There's no doubt that that's one of the big reasons why this particular coronavirus has been so successful in spreading globally, because it's so hard to find. Now, we know a lot about this differences in the symptomology in different cases, but now we're learning, in fact, that there's also long-term consequences. Maybe as high as 25% of the people who get COVID will end up with chronic long-term consequences in multiple organ systems inside their body. These are what we call the COVID long haulers. There's no doubt that the way to avoid that is to get vaccinated and avoid the disease altogether. Now, I've kind of given a quick summary of this. Can we have the slides, please? So I've given a quick summary of what the virus is like, but Dave, we know that the virus isn't just one thing, right? It's evolving a lot of diversity and a lot of different variants.
Yeah, we've learned a lot about this virus, as you were mentioning, Paul, and one of those things is that the virus has to diversify as it moves around the globe. It's picked up mutations and it's caused maybe minor changes in the virus, but we're able to track all of that by using genomics and using real 21st century science to better understand not just the virus, but the epidemiology of this disease. One of the interesting things that we've been talking about most recently has been all the variants that have been out there. I'm going to show a few slides and don't worry about all the data. I'll talk through a couple pieces on here, just the most important parts. But the fact that this virus keeps evolving means that it does come up with different lineages, or what we call variants, that are more successful. And you've been hearing a lot in the news earlier this year about the variant that came out of the UK, what they now call the Alpha variant, and more recently about the Delta variant. The truth is that there are a few variants that are really super spreader viruses. They're supercharged. They can infect human cells faster, replicate more, and get out and cause more infections. And that's what we would expect towards the end of the pandemic. The most successful ones are going to be the ones that spread the fastest. And that's what we're seeing in Arizona. On the left-hand side, you can see in the most recent accounting of this, the Delta virus is making up about 20% of all of our cases. A month before that, it was making up less than 5%. And before that, we didn't even know it existed really. So it has really come in and is starting to cause a significant number of the infections that we do see in Arizona. The Alpha variant, the one that came out of the UK, was dominant. It was over 2/3 of our cases. That's now shrinking as Delta becomes more important. And then the Gamma variant is the one that originated out of Brazil. And it too is becoming more and more important in Arizona. This is pretty much reflected when you look nationally on the right-hand side, on that farthest column. That is the most recent month that the CDC's been tracking. The Delta variant is actually more important nationally than it is in Arizona, but it is growing in Arizona as well. So these critical variants are kind of the natural outcome of the evolution of a virus during a pandemic. I'll show one more slide just talking about this, and this just shows that not all variants are the same throughout the state. And so with some of these, like the variant that came out of the UK, that quickly spread across the state. But we have some other variants that are really found in only select parts, such as a variant that came out of the US-Mexico border region is really in the southern half of the state. Now, when we look at the Delta variant, we're starting to see that really expand. It was only in Maricopa County for a while in the Phoenix region and is now quickly expanded to many counties throughout the state.
So Dave, how do these variants, how did this play into the diagnostics, the tracking, the therapeutic responses to the pandemic? What does this mean?
It's really important not just to find the variants and understand if there's some that are transmitting a lot faster, like what we see with these variants, but also do they somehow evade our diagnostics? Can our tests still identify these when they show up in patients? And do the vaccines still work against them? And what we know is that most of the diagnostic tests that are being used now certainly detect all these variants, not a problem. And then the vaccines, primarily the ones in the US, are doing a great job at preventing infection from all of these variants. So they're all highly effective. The problem is that those people who aren't vaccinated or don't otherwise have immunity are at risk for getting these because they do move so quickly through populations.
Yeah, it's actually been really gratifying that the 3 licensed vaccines in the United States had such high efficacy rates. And of course, we were worried about them the variants being able to evade them, but the numbers are looking good, aren't they? Like, dropping from maybe 90 to 95% efficacy to only 80 or 85. So it really does look like these vaccines are going to hold up against these variants at least.
Well, Paul, one of the great examples of or pieces of evidence that shows that the vaccines are working is when we look at the data, and everybody's seen these, what we call epi curves or epidemiology curves, which just looks at the number of cases over time, whether it's cases that are diagnosed up there in the upper left-hand corner. Here in Arizona, we could see that this just completely dropped off. The vaccines have come in towards the end of the winter surge, have dropped off the cases, and they've stayed at this very low level, which is really exciting. And the trend that we're seeing really across the country in most places, down there in the bottom right-hand corner is the US. We had some problematic states in towards the end of winter and into spring, but pretty much everybody's dropping off. And then we look at the bottom left-hand side, that's the number of hospitalizations. Those have dropped off and maintained low. And then in the upper right-hand corner is the number of deaths in Arizona. And that's maybe the most heartening news from all of this, is that the vaccine has really made the deaths and the hospitalizations drop down to very minimal levels and are essentially non-existent in people who are vaccinated.
So how about locally here in Coconino County, and how's Coconino County going to fit into the environment where NAU is bringing everybody back?
That's a a really good point in that we can't just look at our surroundings here in Coconino County, because we do have a lot of people coming from across the state and certainly from other states. So that's why we do track this statewide and nationally as well. But if we look in Coconino County, the trends are exactly the same. The top there is looking at cases by the geographic areas. That blue line, which was the highest, kind of following the spring break time period, there was a fair number of NAU students in that number, but that has really dropped off to very low levels, along with the rest of the communities in Coconino County. This is what we would expect with an endemic disease, very low level, maintaining at that same pace.
Yeah, so it's not just about vaccines though, right? It's also about herd immunity acquired through cases, and maybe the combination of those things is really what we ought to be tracking.
I agree. And don't worry about all the numbers on this. This is just showing some of the math that I used to try to estimate our immunity in Arizona. And I talk about community immunity because we live in communities. We don't live in herds. We talk here about herd immunity, but it's really important to understand what's going on in our different communities. But across the board in Arizona, we're actually doing pretty good. We know that we have about 50%, little over 50% immunization rate. But as you mentioned, Paul, it is more than that. It is how much immunity we got from the cases. Unfortunately, Arizona had a lot of cases, but fortunately, that has really added to the overall immunity. We may be closer to somewhere between 2/3 and 3/4 of the population actually having immunity.
Yeah. The CDC recommends that people who've had COVID still get vaccinated. And I mean, there's really good rationale there for that, because we know so much about the vaccines and immunity, and not so much about long-term immunity in COVID. But the studies that have been done really indicate that people who've had COVID have resistance to the virus, and maybe equivalent to what we're seeing with the viruses. We just need to the vaccines, excuse me. Unfortunately, we just don't have the clinical trial data to remove that recommendation. So people who have had COVID should still get vaccinated.
One more point I'd like to make is that, because I did talk about communities, and that's not just different locations, although we do see different rates around the state, but it's also different age groups. And that's a really important piece. And I know that these graphs look a little small. On that left-hand side, that's looking at the different age groups and the vaccination rates. And when we look over 65, well over 80%, that's fantastic, because that was the highest risk group for fatalities, and we've seen those fatalities drop off. But we need high levels of immunity across our age groups. And the younger we get, the less we're seeing uptake in immunization. And that's why we think, certainly within the college age population, so effective at spreading the disease. Even though they don't typically get the serious disease, they do spread the virus really easily. And we're not seeing enough immunization uptake.
Yeah, I mean, there really is no zero risk group, though. Even young people can get very serious disease. I mean, the best thing, again, is to get vaccinated. The vaccines are extremely effective against severe disease, and that's what they're really designed for. So the vaccines, of course, are what you and I would push. But what other kind of public health measures could we talk about that would be important here?
Sure. We were left, because we started this pandemic, obviously, without a vaccine. We needed to have what we called non-pharmaceutical interventions. And that's where we talked about washing our hands and wearing a mask and staying socially distant. All that helps, adds layers of protection to prevent somebody from either spreading the virus or inhaling the virus. These are standard public health measures that we use for all sorts of diseases. For something that's highly infectious, that's not a perfect system. In fact, it's nowhere near as good as immunization from what we've seen. It's been really good for some other things like influenza. Influenza disappeared this year. But for COVID, we want to do those things if you haven't been vaccinated, but nothing compares to being vaccinated.
Yeah, I was on a call earlier today, and the person said, "Oh, excuse me, I've got a cold." And I thought, wow, the pandemic is coming to an end when people are getting colds again, because we're not doing those public health factors. But, the data are really clear that outdoor activities are safe, and that dilution of the air, the droplets and aerosol, really prevents, super spreader events, unless people end up in a bar later after the big concert. Then that all goes away. But how about masks? How do you feel about masks in that whole equation?
Well, a few things that we've learned, and we knew those N95 masks that were talked about early on, those provide the most protection. That's what they're designed for, to block out 95% of the particulates that might have virus in it, they work that well. The surgical masks, the procedure masks that we see most people using now, those actually are pretty much the second best. They provide about 60% protection of spreading a virus. So there is some level of effectiveness. And then when people are wearing other types of masks, face coverings, the protective level drops from that as well.
Yeah, I think the bandana over your nose, like Billy the Kid, doesn't help at all.
No, it's really more of a fashion statement.
Yeah, that's right. That's right. So I guess just to wrap this up, my number one recommendation would be get vaccinated. I mean, it is the most effective tool that we have. And so vaccination needs to be pushed, encouraged. I certainly would mandate that my children get vaccinated once they're old enough. But otherwise, that would be my number one. How about you? What would be?
Hands down, it's immunization. You mentioned, about going to a party. You don't have protection necessarily if you're wearing a mask and you're indoors and close together. But immunization actually gives you that protection that you could go to that party. In fact, it's a reason to party.
All right, President Cruz Rivera, thanks very much for giving us a few minutes. We'd be glad to answer questions.
Yeah, thank you.
Great. Thanks, Paul and Dave. We do have questions that came in prior to the town hall, and we'll have some time later to do some live questions. But I do want to present a few that came in early. We did try to group some of these questions together. We've got various versions of these questions I'm going to go through with you. So just to start off and clarify, as President Cruz Rivera mentioned earlier, we do have some restrictions in Arizona. Institutions of higher education are prohibited from requiring vaccinations or mask wearing from students at their institutions. And so because of that, we've gotten a lot of questions and concerns about those, and specifically around the masks. We can definitely talk about vaccination and that, but a few examples are individuals being worried because individuals don't have to wear a mask and putting them at risk since they're not wearing a mask. And since masks are only recommended, won't people not wear masks and put people at risk and increase their opportunity for transmission and outbreak? Can you respond to that a little bit, just from your perspectives on those concerns?
Well, from a public health perspective, we certainly have risks all the time and all around us, and we want to do things living in a community to reduce that risk to ourselves and the risk of things that we might do to other people. This is why we wear seatbelts when we drive, and we follow other health recommendations. This is really what we need to really enforce, or at least implore upon the students and the staff and the faculty, that this pandemic virus is still with us. The emergency may be over as we move into the next semester, but the virus is still with us. There's still going to be people at risk. So there are things you can do to not only reduce the risk of you potentially being that outlier and getting a serious case, but you spreading it to somebody who could be at serious risk for illness. And so this is why immunizations we see as the most important, the most effective thing that can be done and encouraged. There is not a medical reason not to get vaccinated. Some people think that there might be. There isn't. There are different types of vaccines that can be used for different people. There's not a medical reason not to get vaccinated. So we really want people to do that. But if you can't, make sure that you're protecting your loved ones that are at high risk. Wear a mask around them, follow the precautions, and obviously whatever precautions NAU puts in place. These are going to be very important.
Yeah, I mean, immunization is just so critical, but there are situations where people are around, they have friends or family who can't be immunized or immunocompromised in other ways. And so, in those situations, masks, physical distancing need to be considered. If you are one of those special people, then you need to be talking to your healthcare provider. I mean, we're scientists here. You need to be talking to your healthcare provider about what you need to do to protect yourself and your family.
Great, thanks. We touched a little bit on the variants. There's a lot of information on the Delta variant in particular right now out there. The World Health Organization's recommending, made some recommendations about masks, even for vaccinated people due to that variant. Can you give us a little bit of your perspective on the increased threat or additional things we need to do based on the Delta variant, and if it poses a different threat than the normal strain?
Well, let me just start and I'll let the expert jump in here. But when we get these highly transmissible variants, it means that everything that you did before has to be done better. Because, physical distancing, outdoor activities are great. You're not going to catch the Delta variant from running past somebody on the urban trail. You've got to do those things better. And it's not that you give up and say, well, we got the Delta variant, we're not going to physical distance anymore. You got to do it better. And it really is more imperative that we get more people vaccinated.
Yeah, those are great points, Paul. I got to say, Josh, that the concern with the Delta variant and these other ones that are really the dominant ones is that they're kind of like water. They will find the cracks in the system. And so if there are susceptible people in the room, it may have been harder for the older versions of this virus to infect those people. But these will find the next susceptible people. That is why we continue to have cases at a low level, but we're going to continue to have cases. That this is how this virus is now becoming endemic. So that the virus has changed in that way. It's not more serious. It's not causing more serious illness that way, but it is spreading faster. But there's also potentially some good news behind that this virus is starting to act potentially like other human coronaviruses. As it's becoming more normalized, more adapted to us, it spreads really easily, just like the common cold virus. It still causes serious disease, but if you're vaccinated, that actually turns it into the common cold at worst for almost everybody.
Great, thanks. Another topic we've got a lot of questions coming through on, and you touched on this a little bit about the immunocompromised individuals, but we're getting a lot of questions about that from faculty, staff, and students that are concerned about their health status. You mentioned earlier, Paul, that they obviously need to be in touch with their healthcare provider. Is there anything else you can add in terms of additional risks or issues with vaccination for those with immunocompromised systems?
So again, I'm not going to give medical
Sure.
advice to 700 people all at once. I shouldn't give medical advice to anybody, I guess. But talk to your healthcare provider, and they will tell you. They'll give you advice about vaccination. But we really think that vaccination is safe. We've got years of experience with vaccination, and these vaccines look as good or better than anything we've ever seen.
And one other piece to add into that too is just like you were saying, we've had vaccines for years. We've had to deal with immunocompromised and immune suppressed populations for years. And so this is not a new thing. It feels new, but there are things that unfortunately different parts of our society have to do to protect themselves while everybody else kind of gets back to business. But here's one thing that we can all do to support people that are still at high risk for disease is get vaccinated and follow those recommendations.
Great, thank you. Thank you both, really appreciate that. We'll have some time as we go through the rest of the program for some questions, and we invite you to help weigh in wherever you see a good opportunity when we're covering any of these other topics. Karen and I are going to move into some updates on NAU protocols specifically. As I mentioned earlier, we are prohibited from requiring masks and vaccine of our population, but we are definitely recommending and highly encouraging all of our faculty and staff and students to get vaccinated. And we also were recommending masks around campus in any kind of public settings that you're in. We do, again, we're prohibited from requiring them, but we are able to do that in a couple scenarios, and we are doing that. That's at our campus health facilities and on public transportation, which is our NAU buses. Again, vaccines, specifically talking about that, we are not able to require them, but we are recommending them for everyone. We are also going to be really providing opportunities for people to get vaccinated on campus. In the months of July and August, we've got vaccine available at the NAU Fieldhouse. And we'll post those details on our website, and that information is available for people to get that information. We're also planning to do some incentivization of vaccination for our student population. So we've got lots of people working on incentives, raffles, and prizes, and different things from Apple Watches, gift cards and coolers, parking, those type of things, in order to really try to incentivize our students to get vaccinated. Testing is another thing that we really leveraged heavily over the last academic year that we are not able to require mandatory, but we again are encouraging it. We will have testing available at the field house again on a voluntary basis for our community. And then last thing I'll say before Karen talks a little bit about some of the things we're continuing to work on is campus rec and the rec center. We've got a lot of questions about the status of campus rec and the rec center. We are planning to be fully opened at campus rec. The campus rec center is currently open to currently enrolled students for the summer and faculty and staff that have summer passes for the rec center. And we are working on all the protocols to have that facility fully open for the academic year.
Thank you, Josh. In the meantime, we're also in the process of considering a number of other of our protocols, policies, and guidelines for opening with the vision of a full, vibrant fall 2021 semester. And we have our steering committee, our public health advisory committee, and we're going to be standing up a couple of other advisory committees, including one focused on academic success, learning, and engagement, that will give advice and make recommendations to our steering committee. Among the things that we're looking at is the question of capacity. At this point, we can say that we do intend to operate at full capacity for all indoor and outdoor spaces at NAU and our locations throughout the state. That means also that our events will operate with full capacity, lifting event size restrictions that have been in place for some time. We also intend to remove physical distancing requirements, while at the same time encouraging and supporting individuals to make appropriate choices regarding their own personal space. We are intending to nurture a physical distancing friendly environment and ensure that everyone can exercise their individual choice in the interest of their own health and the well-being of the community. We also are going to strongly encourage preventative monitoring and use of exposure alerts that are available to our faculty, staff, and students throughout the semester and the year. We have the COVID Watch app that many of our faculty, staff, and students have been using over the last year. We're going to encourage continued health monitoring, personal health monitoring for COVID-like symptoms. And as Josh mentioned, testing when that it seems appropriate, when someone experiences what either a COVID-like symptom or suspects that they've been exposed, and that will be available. We are also going to continue to follow protocols that we used over the last year for isolation and quarantine, and we will have an isolation and quarantine space in our residence halls on campus. We did not last year, during some of the worst episodes of the epidemic, ever exceed the capacity that we had. So we believe that we will have adequate, more than adequate capacity to provide that option when it's needed. We're going to closely monitor for NAU, local and statewide and national trends to prioritize the safety of our community. And we're going to remain very vigilant and ready to pivot any and all operations in the event of new developments. And so we're going to, in effect, be watching carefully for any outbreaks that we might experience going forward. And our Public Health Advisory Committee that Paul and Dave are a part of will continue to be consulted throughout the semester and the year as we monitor health trends. There are also a lot of questions that we've received, particularly from faculty, about the use of NAU Flex, which was a very innovative platform that we used during the last year as we had to pivot to operating our learning experiences in multiple modalities. And this is a key issue that will be considered by our Academic Success Learning and Engagement Advisory Committee. At this point, we have structured an academic schedule of courses that involves distinguishing classes on the basis of modality, and there are very few courses that are in the current schedule that are operating with the NAU Flex platform. That doesn't mean we won't be using it, but we're going to be looking at how we might use it in a flexible fashion to support students and our faculty in situations of illness or other kinds of exigencies that might come up in relation to the pandemic or other factors for that matter. And lastly, I think actually Josh already mentioned the Campus Recreation Center is going to be fully open and staffed in the fall. So we're ramping up in a phased way through August 23rd to have all those facilities available to our students and faculty and employee community.
That's probably
Josh?
worth saying twice. As many
Is it?
questions,
Okay.
many questions as we've gotten
I
on,
just
on
realized I was
that.
being redundant.
It probably is worth mentioning twice. So we're going to move into some of the question period of our program. Again, I know that we've got folks monitoring the live chat. I'm going to start by addressing one of the questions that's come in a lot in a lot of different ways regarding our in-person and remote work and options there in terms of our return to in-person expectations for our faculty and staff and moving forward. So we've gotten a lot of questions and I'll give you a few examples in terms of people, putting forward that it's been really helpful to have that flexibility to work from home and provide help manage some of their childcare, some healthcare needs and those things, and would really like to continue that. We've got questions about will there be different policies and requirements across departments across the university, and then specific questions about, as other institutions all across the country are doing, what will be the kind of defined times to be back. So when do we expect people to be back? So I'll lump those together and just talk through that a little bit. We have definitely learned a lot throughout this pandemic, and as everyone knows, we were really forced to pivot. That's a word that's become a part of all of our vocabulary over this pandemic, and moved quickly to getting people up and running remotely. So we've done that. Our faculty and staff did a fantastic job of doing a lot in a very small window, and really helping us stay operational and get through the academic year and keep things running. So we appreciate that, and we have learned a lot. We've learned that we can do a lot of those things remotely, and we're definitely looking at ways to make that more part of our normal workplace and environment. As you heard from Dr. Cruz Rivera earlier, we're definitely also at a new point for a relaunch in getting all of our 30,000 plus students back in action this academic year. So with that in mind, we are planning to bring employees back in person. As we always have, the faculty have always traditionally come back the week before classes start. Classes are scheduled to start on August 23rd. Faculty will be back on August 16th. We're also using that date as a marker for the rest of our employees to be back in person in the workplace. So we'll continue to use the time between now and then, this month plus, to stagger that return back. We are, just so everybody has some context, we do have a lot of people back already. We're probably just a little bit over 50% of our employees are back in person on campus here in the Flagstaff Mountain campus. So we'll continue to ramp up towards the start of the semester for that. Also with that, we are working on processes and structures to continue to evaluate and put in place some of those flexible work options. So we're going to put in a structure and a framework that will give us ways to do that and set some policies and guidance at the university level, and then also ways for divisions and individual departments to adapt those based on the needs of their students and other customers, and what that looks like for any individual department may vary within that overall framework. And then we'll also even get down to the individual jobs and individual employee level based on what those look like. So we'll have a framework for evaluating those flexible work options moving forward. Next question we have, and Karen, we'll have you start with this one. NAU continues to recommend that those that feel sick stay home to help limit risk of COVID. If that's the case, what is a sick policy for students in classes, for faculty teaching, and for staff coming to work?
Well, just to emphasize again, we don't want to encourage any faculty, staff, or students to come to campus if they're not feeling well, and encourage them to get proper care for what their condition might be. And then what we seek to do, and we'll develop some guidelines with the input of this advisory group and then ultimately the steering committee, is to come up with guidelines that allow faculty to work flexibly with students in cases where students become ill and need to miss class. Or we've also got situations sometimes where the faculty become ill themselves and may need to work differently or have interruptions of their work. And this is where we will likely utilize the things that we've learned over the last year in development of the NAU Flex platform and bring that on to enable students to continue to engage in their classes and continue to learn and be successful through the course of the semester. Some of the things that I've heard questions about, which we need to further deliberate around, is requirements about having documentation of illness on the part of students to present to faculty for the kinds of arrangements that faculty might make around illness. And there's some concern, for example, about the burden that places on healthcare providers, particularly our health medical services area on campus. And so we'll be talking about all of that and try to figure that out and give people clear guidance, faculty clear guidance, and students as well.
Great. And I know that's part of what you mentioned earlier, that academic success and engagement group that you're convening will work through some of those. I'll just add on the staff side, and Paul and Dave alluded to this too. That is one of those things that's good practice that we've got better at during this pandemic, is keeping sick people away from non-sick people, and really want to encourage to continue to do that. So again, the university's got some pretty generous sick leave, and we'll encourage people to use that whenever necessary. And then we'll also, again, be looking at these flexible work options for supervisors and employees to work together to keep things moving that way. Next question we had that came in beforehand has to do a little bit, Karen, and I'll toss this one to you to start again, and maybe also Paul and Dave. In terms of limitations on large capacity rooms to promote physical distancing, for instance, would we have certain course limits, size limits for courses, and then using, classes that are, built for a lot more capacity than the actual attendees that we have for classrooms, for classes, events, and other types of things. Any comments you have on that? And Paul and Dave, would love to hear from you too on capacity.
That is a matter that we need to further explore with our input from our experts and faculty, staff, and students. The situation that we have is that we want to provide the best of possible learning experiences and environments for our students, at the same time as we want to create an environment in which the well-being of our students and faculty and staff is supported. The limits on physical distancing, if are going to be lifted, then we need to think about what that implies for, I think, both small classrooms as well as large classrooms. But it seems to me that that's a matter that I'll defer to our experts around, that the larger number of people in a room does have an impact on the possibility of distancing. But at the same time, if we're utilizing smaller rooms to full capacity, we may have the same kinds of constraints in those circumstances. So we're going to need to look at that and give clear guidance and set guidelines for people. But I'd invite either David or Paul to weigh in.
Sure. I completely appreciate the position that the university is in here, because we're trying to move into the post-pandemic and trying to get at least into the new normal. The concern here is that these variants do move very easily. They're very successful at spreading around. And, I think that the more people you have in a room that are not vaccinated or don't have immunity, the more likely you are to have transmission in a room. So I do think that that's a risk. That is a risk that we're going to have to live with. It is a risk that each individual person can mitigate themselves by being vaccinated. I know I keep standing on that soapbox, but it is the one thing that is ending this pandemic, and we want it to end on campus too. So this is a thing that everybody can play a role and have some responsibility in and some ownership in the success of the upcoming semesters. And so I think that there's a lot that's being discussed about how do you increase airflow, which I think is really important. And then also the continuing, encouraging the use of masks, especially for people who haven't been immunized.
Yeah, and of course, the 6-foot rule for physical distancing, that's a guideline. And we know that the aerosols can move further than 6 feet, and especially if you're sitting in a room with 200 people for an hour. Sounds like a classroom. I
Right.
sat in once. Then, that 6 feet is not going to protect you. And so it really, immunization is really what's going to get us there. I think the other thing is the university will and has to monitor the COVID case rates continuously. And so as we move into the fall, if we start seeing an increase in rates, and if we see an increase in rates on campus, there are trigger points there that I know that the state of Arizona, the Department of Health can step in, and we can change some of these guidelines under those conditions. So continually monitoring what's happening with the pandemic is going to be very important.
Great. And Paul, you don't have my list of questions here, but you teed it up perfectly. The next question is about outbreaks and what will happen in case of an outbreak in terms of thresholds, and how will we monitor the university, how will we monitor when we've reached a heightened status. So maybe to start, I can mention that is definitely part of our planning. We are looking at all of those tools that are available to us in terms of, Karen mentioned the COVID watch. Again, we utilize the health check function and our mitigation testing over the past academic year. We're evaluating all those tools now. Obviously, coordination with the county, state, and other agencies in terms of monitoring infection rates and those type of things. I'd love to hear from you, Dave and Paul, again on just some thoughts about things that trigger get labeled as an outbreak, or when we really need to be concerned that we've got some concentration of infection.
Well, so the trigger will have to be certified by the Arizona State Department of Health. Okay, so that's not something that President Cruz Rivera will be able to declare an outbreak, nor will Dave and I. So, but we obviously will be monitoring the cases, and that will be, of course, verified by diagnostic tests, FDA approved diagnostic tests. I might just mention that we are planning on looking at wastewater again. And while there is no international standard for what an outbreak is based upon wastewater monitoring, it will stimulate increased surveillance, voluntary surveillance. And so I think that there are ways that we can watch this. And if things start to go the wrong direction, I think there are some more serious interventions that we can take.
I think one other thing to point out though too is that we don't know what we don't measure, and we don't want to be flying blind. And so even though the pandemic is going away, at least here in our backyard, we still want to stay on top of it and still do testing. And so here's an area where students and staff and faculty as well can do something to be part of this, is participate in testing strategies that the university puts together. It's an active thing you can do. Even if you're negative every single time you're tested, you're providing data to help us understand what is going on with the virus. And so I think that there's a real positive side to this, and really encourage people to participate in those programs.
Great. That's extremely helpful. That is a good piece of our pre-questions that came in. So we'll kind of shift gears now to some time to have some of the live questions come in. We know that there's folks monitoring that chat, and we will look for a few of those to come through to us, and I'll pose them to the right person or persons that are here to answer those. Looking, nothing's coming through. Just want to check with our team that's monitoring those if they have questions that they can feed into the committee.
Josh, while we're waiting for
Yeah,
that,
sure.
I'd like to add in and maybe speak specifically to the students that might be watching today, is that I was talking about testing. That's one thing that we can do. And of course, getting immunized is another. But I think that we should look at this as an opportunity this is a very special time of your life, not just because you're in college, but it's happening during this very strange time in human history. And it's things that you can do to help make it better for yourself and for everybody else. So I want to encourage everybody to do essentially one thing, essentially carry 2 buckets and fill 1 bucket full of compassion and 1 bucket full of courage, because we all have to kind of come through this and get out of this together. We have to have the courage to step in, do the things that are necessary and to pull out of this and move into the new normal. But we also have to have compassion that everybody's going to do that at different speeds and has different comfort levels. So, we've seen a fair amount of this mask shaming or vax shaming over the past several months. That is something that we can all agree together to get past. We should be beyond that and actually help each other through this. So I think that there's going to be a lot of opportunities when interacting with other students and staff on campus during this coming semester where we can really improve everybody's lives by doing that.
Can I jump in and ask maybe that you speak a little bit to the faculty and staff who were asking to stand up this fully vibrant fall semester and are committed to doing so? They're part of the NAU community and want to see all of our students be successful, but have understandable concerns about the impact that a younger population in concentrated circumstances might have on their own health and well-being. What advice would you give to them to do the right thing for themselves and for the community?
Well, let me give advice first to Paul, because he's part of that. I mean, he's right next to me, but I know that he can speak to everybody else, which is essentially what's great is that we're seeing incredibly high immunization rates among the faculty and staff. That's going to be your level of protection. That is, that kind of force field that we've been looking for. And so even though you're likely to have students come into classrooms that may have virus that might cause that spread, that there is one thing you do to absolutely give yourself great protection. But the other thing is that you can take then this moment to help the students grow through this period too. And that's it's special in a way that not everybody's has this opportunity. And I think we can help each other and learn together through this. And I think that the faculty and staff have a great role to play.
Dave was my student, and so he could give me that advice.
I was.
But I guess the other thing I would add is trust the vaccines. I mean, unless you have a special situation that vaccines are working, I would feel very comfortable myself standing in front of a 200 student auditorium and giving a lecture. I think that, there's only so much we can do. We're going to do a lot, but there's only so much we can do to encourage unvaccinated people to get vaccinated. But each faculty member can certainly speak to their students and encourage them not to come to class if they're sick. That is really an important point. And they can do that by saying, look, if you're sick, don't come to class. I'll work with you to help you get through this. And I think that that's an individual action. It doesn't need to be an NAU mandate or anything like that. Faculty need to be compassionate and encourage that behavior.
Thank you.
Great. Thank you very much. I've got questions coming in. We've got a handful. I'll try to emphasize some of those, again, taking advantage of Dave and Paul being here from the public health and science perspectives, knowing that we can follow up on some of the other NAU policy specific things through some of our other means. But we do have a few of those I'll get to as well. But you just talked about a little bit about, again, continue talking about vaccine. What about what do we know about booster shots? And will there be a need for booster shots and timing on that? Any updates on those you can provide for us?
So some of the recent data that's coming out, and we're getting new data all the time, and it really is continue to add evidence that how effective these vaccines are. It looks like we get pretty good, actually really good immunity that lasts for maybe 12 months or longer from the immunizations when you're fully immunized. We don't know how long that could last. It could be several years. One of the things that we do know, and Paul can speak to this because he's had a research program on this, that we've seen the immunity they get from other coronaviruses, and that can last for a few years as well. It is possible that boosters come out either because immunity starts to wane or because the virus changes enough that you need an updated booster shot, just like we're do with influenza, where you're supposed to get an influenza shot every year or every couple of years, because they might have to put some new components in it to respond to the changes in the virus.
Yeah, right now there's no evidence that we need boosters. I mean, the vaccines have some legs. They're lasting as long as we have monitored them. That's not to say that won't change. I mean, and so this is an area that is being watched very, very closely by the medical community. And if that becomes necessary, as we've already seen, the vaccine producers can deliver those boosters very rapidly.
One of the great things about this vaccine technology, the mRNA vaccine technology, is that they can make tweaks and changes to that formulation very quickly and do trials really quickly, much faster than we could previous years. So again, it's one of these things where thankfully this pandemic's happening at this day and age where we have this technology to respond to it. And we think it'll be effective moving forward.
Yeah, all of us have experienced the multiple vaccinations against influenza every year for most of our lives, right? I mean, this is like going from a horse and buggy to a supersonic jet. It's just an amazing step forward.
That's an apt analogy. Yep.
Great. Another one along these same lines is related to vaccine. It's currently under emergency use authorization. How long does it take for a vaccine to move off of that status and be fully approved? Any other thoughts about that?
Yeah, I'm not sure I can definitively answer that, but let's make it clear that the emergency use authorization does not cut corners on the testing of the vaccine. The clinical trials and the efficacy and the safety are exactly the same as for full approval. What's different is the manufacturers are authorized to start producing the vaccines before they've been proven effective. And so the US government put hundreds and hundreds of millions of dollars into the vaccine companies so that they could be producing the vaccine while they were getting the data. And when the data came in, it's exactly the same data as the full authorization. What's different is they go back and they certify all of the manufacturing that has been done before. So I'm not sure exactly how long that will take, but it will happen because the data are very good from these clinical trials.
Great, thank you. That's extremely helpful, I think, for our community to hear. A couple other ones I'll jump in just to speed round a few of these, to get as many in as we can. We've got questions about campus rec again. Will that include the pool and aquatic center? So again, working on all of those procedures. Did have a meeting yesterday where this was a topic of discussion. The priority will be getting the aquatic center open for student use as soon as we can, and so that will be priority, and that is the intention for our fall opening. Will there be a cap of people on buses? So again, remember, buses are one of those areas that we are currently going to be requiring masks on. Again, one of those protocols that we will continue to evaluate between now and the kickoff of the new year. But as of right now, I'm not aware of any plans to cap capacity on buses. Will faculty be able to work with disability services to request accommodations related to COVID? Short answer there is yes. All of our employees have access to request accommodations. We are working on those protocols. There's standard accommodation requests that everyone's eligible to pre-COVID. There are ways to request reasonable accommodations for medical and health conditions. So those obviously stay in place. And then we are working on all the rules and options related to COVID specific accommodations. Let me see if there's, here's another one. Can you speak to the effectiveness if a vaccinated person is wearing a mask to protect their unvaccinated child who's not eligible for a vaccine yet, or around unmasked individuals? Again,
Sure.
we'll do the disclaimer that we're not providing medical advice here, but
Not at all. Not at all.
but just anything you can say about that.
So a couple of things. We've heard about things like breakthrough cases where we've gotten people have been infected after they've been vaccinated. And in truth, the vast majority of all those are because somebody was vaccinated, they got exposed to somebody else who had the virus. I mentioned a force field. The vaccine is not really a force field. That it can't make the virus bounce off of you. So you could be infected by a virus after you've been vaccinated, but your immune system responds so quickly that it clears it and you never develop serious disease. You might not even ever get any symptoms, or you might get mild cold-like symptoms, which is your immune system responding. Now, the concern is, can somebody who's in that position actually transmit it to somebody else, especially somebody who's unvaccinated, like maybe a child? The risks are exceedingly low for transmission because you're not developing enough virus and generating virus that you can then expel out and transmit onto somebody else. We are not seeing documentation of transmission after people have been fully vaccinated, even though they can test positive or have a mild case. You could be like a Chris Paul and have just an asymptomatic, and then you test negative just a few days later. That's the vast majority of those instances. They're not at risk really for spreading it to other people.
Yeah, there was a vaccine breakthrough cluster with the New York Yankees. And the only reason they knew that was because they test those Major League Baseball players all the time. And so they picked it up on the test, but there were only 1 out of 8 even had mild symptoms.
Great, thank you. We've got a handful of questions related to policies around events, meetings, gatherings, and capacities for the upcoming semester, including student groups and organizations being able to hold in-person meetings. And that, again, is part of the work that we're continuing to work on. Again, our intention is to make that as available as possible, and we'll work through any protocols and rules around that and make sure that gets communicated as soon as those are ready. And looking at the time, we're about at time. Want to give President Cruz Rivera a few minutes to wrap us up, and thank you all again for your time and participation today. Thanks to everyone that made time to represent the various committees and steering groups that we have working on the protocols. Thanks to you, Karen, for co-chairing those and co-hosting this session with me.
Thank you.
Thank you. I want to add my thanks to those expressed by Josh, to our panelists here today, David, Paul, Josh, and Karen. I also want to express my appreciation for everybody who has logged into this meeting today and has been so attentive and so active throughout the past few weeks in helping us shape what the fall 2021 semester will look like. Please do know that all of the questions that were raised today and we responded to, as well as those that we may not have had a chance to get to and were presented through the chat, will be addressed in an FAQ that will be published in the near future. We will be sending a campus announcement out with that information. I think from what I've heard today and from what I've heard over the last several weeks, it is clear that the magnitude of the challenge we face is significant. We are trying to define what NAU will look like in a post-vaccine world. We are looking to ensure that we can properly address the needs in a safe environment of over 30,000 students that have entrusted Northern Arizona University with their aspirations, not only in terms of their studies currently, but what they hope to accomplish in life. And so I am so excited to have not only the challenge to make sure that we can meet their aspirations, but to be able to do so with the campus community that we have. Because what I've learned during the last 7 months as I've gone through the search process, and more recently in the 3.5 weeks that I've had the privilege of serving as the president of NAU, is that we do have that courageous and that compassionate community that David was talking about earlier in terms of how we need to approach this challenge. And I think we're ready. I think we're ready to meet the challenge. All of the concerns that have been raised so far are concerns that we take very seriously, that from the science we know can be addressed through increased levels of immunization. We're moving from a pandemic to an endemic disease that we can live with and do through the right risk management and mitigation strategies. We are a community that is a community of care. And as a community of care, we do respect individual choice. And we do so with the confidence that in our community, individual choice is accompanied by individual responsibility. And so as we move forward to make sure that the fall 2021 semester is all that it can be, I am counting on all of our members of our campus community and our friends outside our campus community, not only in Flagstaff, but throughout the state, to be partners. So if there's something that any one of us can do, regardless of our vaccinated status, to ensure that we're not only safe, but that we are creating an environment where others feel safe, I am sure that we will do that. And that I will hope that everyone will join me in making sure that that is the case. It is a privilege to have the opportunity to address you today. I want to thank the President's Fall 2021 Planning Committee, as well as the Public Health Advisory Committee for all the work they've done so far and that they will continue to do. Please remain active, raise your voice, give us your advice, let us know what your concerns are. We still have several weeks to streamline and refine our policies and practices moving forward. And we will use every single day that we have between now and August 23rd to ensure that we are best positioned to deliver the NAU experience that we all, for the last 120 years, have come to know and so much respect. Thank you so much. Be well. See you around campus.